Each code must start with a clear and emphatic announcement that I will be team leader.
Hey everyone, the patient is in V-fib. Plinio, will you be the chest compressor?
Yes.
Please start chest compressions now. Thank you. John, you are the airway person. Please start bag mask ventilation immediately.
Okay, starting bag mask ventilation at 8 to 10 breaths a minute.
Joanne, you're going to be the defibrillator person. Find a defibrillator as soon as possible. Let me know when it gets here.
Okay, I'm going for the nearest defibrillator.
Sharon, you will push drugs. Drop some drugs that we're going to need. Let me know when you're ready.
Okay, I'll start preparing multiple doses of epinephrine and some amniotic.
Thank you. Brandy, you are the documenter, and most importantly, the timekeeper. Start documenting all events. Check your watch. This is time 0 starting now.
Sure, I'll be documenter and timekeeper. 16:30 is the time now.
Shay, do some medical detective work. Find the patient's chart, please, and review the past medical history.
I'm right on it.
Look particularly for advanced directives, diagnosis of malignancy. Give me a report as soon as you can.
Okay. If I can't find the chart, I'll check the computer records.
Thank you. Airway person and chest compressor, you will switch out every 2
1
minutes.
minute remaining
Brandy,
before
keep watching
break.
the clock. Monitor the pace of the chest compressions. The compressor should be hitting 10 compressions every 6 seconds. Let him know if he's too fast or too slow. At about 1 minute 40 seconds, announce that the defibrillator person should charge up. I will tell them the energy level to use. Announce when we go to 2 minutes.
Will do.
The first dose of epi is ready.
Thank you, Sharon. Don't give it yet.
Okay.
I haven't been able to find the chart yet, but the nurse thinks he does have heart disease. She's not aware of any advanced directives or malignancies.
Thanks, Shay, but we have to find the chart fast.
10 seconds
15 seconds
before the
Thank you,
break.
Brandy. Joanne, this is a biphasic device, so select 120 joules, please. Charge the defibrillator now.
Okay, we're charging.
That's 2 minutes.
Stop chest compressions.
1.
The rhythm is still V-fib.
10,
We will defibrillate.
9,
Everyone stand back,
8,
please. Is everyone
7,
clear?
Yes,
6,
clear.
Clear.
5,
Shock
4,
delivered.
3,
Compressor,
2,
start re-CPR.
1.
Yeah, starting compressions.
Airway guy, restart ventilations.
Restarting ventilations at 8 to 10 per minute.
Sharon, let's give 1 milligram of epinephrine. And Sharon, please don't forget to flush with 20 mils of saline. And raise the arm for 10 seconds.
Okay, so you want me to give 1 milligram of epinephrine with a saline flush and raise the arm.
Yes, please. And tell me when you're done.
Any medication which is required during ACLS should be administered within the first 30 seconds after a break in chest compressions. This will give it the maximum time to circulate and reach its target, such as the heart, in plenty of time before the next attempt at defibrillation.
1 milligram of epi going in. With a saline flush. And I'm raising the arm.
Epinephrine redirects blood away from less vital tissues by vasoconstriction and towards the most vital tissues, heart and brain, by mild vasodilatation. Increased perfusion of the ventricle may make it easier to successfully defibrillate to sinus rhythm, or easier to convert asystole into VF and then to convert it by defibrillation into sinus rhythm.
Thank you, Sharon. Plinio, you may be ventilating a little too much. Slow down a little, please.
Okay, I will slow down.
Avoid hyperventilation and never give bicarbonate. This is because during chest compressions, oxygen delivery to the heart and brain is minimal, and the triggers for oxygen release are hydrogen ions, high CO2, 2,3-DPG, and increased temperature. Hyperventilation and bicarbonate reduce the levels of hydrogen ions and CO2 and can dramatically cause a deterioration in oxygen delivery to vital tissues.
John, you're drifting off center. Realign, please, to the lower third of the sternum and the midline.
Looking to see correcting compressions.
Okay, the epi should have circulated by now. Plinio, can you start capnography monitoring? Thank you. Please review our efforts so far.
We delivered the first shock in almost exactly 1 minute. We've done 2 cycles of CPR.
1 minute remaining
We're 5 minutes into the
before
resuscitation.
break.
We're still in V-fib.
Okay, thank you. Shay, what did you find in the chart?
The patient does have coronary artery disease, and he had an MI 2 years ago. He has hypertension, hyperlipidemia, and he's a smoker. He has peripheral vascular disease, but definitely no advanced directives and no cancer diagnosis.
Good work. Let's reconfirm with the family member or nurse that this is all accurate, please.
Okay.
Flotation.
Okay, guys, what are we missing? Any ideas?
Only 30 seconds
CPR is
remaining
high quality.
before
We have
the
shocked
break.
and given all the appropriate drugs. Airway guy, how is our end-tidal CO2?
Consistently about 10 millimeters mercury, if we considered our 6 H's and 5 T's.
Great suggestion. Shay, address the H's and T's and tell me if any of them seems very likely.
Okay. I just spoke to his wife, and he's been having recurrent syncope. The
10
medical team was
seconds
preparing a
before
24-hour Holter
the break.
monitor, so the best bet is a primary arrhythmia.
Okay, we have to get amiodarone at some point, so let's try it. Sharon, please give 300 milligrams amiodarone, flush with normal saline, and raise the arm for 10 seconds.
Okay, 300 milligrams of amiodarone with a flush and raise the arm. $300 milligrams of amio are in.
Okay, looks like we have asystole.
8,
It's 10 seconds.
Okay, we won't be giving a shock.
5,
Let's start high-quality
4,
CPR again.
3,
Okay, shock is
2.
aborted.
1.
Okay, let's give another 1 milligram of epinephrine, flush that with normal saline, and raise the arm for 10 seconds, please.
Okay, 1 milligram of epinephrine, flush with normal saline, and raise the arm.
Thank you. We're in VTAC. Let's deliver a
10,
shock. Everyone
9,
clear, please.
8, 7,
Is everyone
6,
clear?
5,
Clear.
4,
Please deliver shock.
3,
Shock delivered.
2.
Okay,
1.
let's start restart CPR.
15 seconds from change out.
Okay, Joanne, please select 200 joules now and charge the defibrillator.
Okay, charging defibrillator.
That's 2 minutes again.
John, please stop compressions.
Stopping compressions.
Clinia,
10,
please check the cardiac
9,
pulse.
8, 7, 6,
He has a pulse.
5,
Great. The
4,
rhythm is sinus
3,
tachycardia. We have
2,
return of spontaneous
1.
circulation. Please abort the shock, Joanne.
Okay, shock aborted.
I think he's breathing. We have return to spontaneous ventilation.
Great. Let's start immediate post-cardiac arrest protocol.
Okay.
Clinia, check the pulse ox, apply an oxygen face mask. Titrate the oxygen flow down to give a saturation of 94% or more, please.
Okay, checking the pulse ox.
John, check the blood pressure. If it's less than 90 millimeters mercury, systolic, or a mean of 65, give up to 2 liters of normal saline quickly, please.
Okay, checking the blood pressure.
If the systolic remains low after that, let's start dopamine at 5 to 10 micrograms per kilogram per hour. Let's see if he wakes up in the next few minutes. Joanne, let's check a blood sugar and a 12 EKG, please.
Okay, checking the blood sugar and 12 kg.
Shay, the patient appears to be coming around. Let's organize an oxygen tank, a transport monitor, and arrange an ICU bed. And let's travel to the ICU with a defibrillator and a supply of resuscitation drugs, please.
Okay, I'll arrange for the ICU then.
Randy, please write up a summary of all events and take it up to the ICU as soon as possible, please.
Will do.
John, Plinio, Sharon, transport the patient to the ICU, please.
Okay.
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 Shay, please give a report to the ICU attending and ask if we can come up immediately.
Sure.
And everyone, as soon as you're done, let's all stay for 20 minutes and talk about it in the classroom for a debriefing.
Okay.
Okay.